दिस इज डॉक्टर शानू श्रीवास्तव. आई एम ए पेरियोडोंटिस्ट. मैं मसूड़ा एवं पायरिया रोग विशेषज्ञ हूँ एंड करेंटली आई एम प्रैक्टिसिंग इन राजनगर एक्सटेंशन गाजियाबाद. In last video, I talked about that you should go to the dentist at least once a year for scaling. But many people have some myth about scaling. In this video, I am going to clear some myth. The most common myth that we heard about scaling is it causes loosening and mobility of the tooth. When patients come to us and we advise scaling to them, they ask generally, डॉक्टर साहब सफाई के बाद मेरे दांत हिलने तो नहीं लगेंगे, सफाई से मेरे दांत कमजोर तो नहीं हो जाएंगे? And the answer is no, it does not cause any mobility and loosening of the tooth, whether it enhance your oral health. See, what happens is most of the patients come to us with heavy deposits. Normally, your tooth should be held by gums and the underlying bone. In case of heavy deposits, because of that deposits, gum recedes and the underlying bone has been lost. In that case, tooth is actually held by that deposit. In scaling, when we remove that deposits, then the tooth gets space and it tends to mobile. If the loss is minimum, then after scaling within a week or two, tooth gets stabilizes by its own. If the mobility is still there after 2 weeks, then we have another treatment options to stabilize the tooth. So it was not the scaling that causes mobility of the tooth, it was the deposits that causes mobility of the tooth. Moving to the next myth, the next most common myth that we heard about scaling is it causes sensitivity of the tooth surface. See, there can be several reasons of sensitivity. If you have cavity in your tooth, then in that case also you can feel sensitivity. आपको ठंडा गरम लग सकता है. If you have gums diseases or gums problem, in that case also you can feel sensitivity. If you have attrited tooth surface, that means अगर किसी भी वजह से आपके दांतों की सतह घिस गई है, then in that case also you can feel sensitivity. In case of gums diseases or gums problem, we advise scaling to the patient. And 1 week after scaling, sensitivity reduces. Patient might feel sensitivity for 2 to 3 days or sometimes a week, because in scaling we are exposing the covered part of the tooth in the oral environment. जो पार्ट डिपॉजिट्स की वजह से छुपे हुए थे, अगर हमने डिपॉजिट रिमूव किया स्केलिंग में, देन वो पार्ट अनकवर्ड हुए, तो उन्हें अडेप्ट होने में समटाइम्स 2 to 3 days लगता है एंड समटाइम्स 1 week लगता है. सो till that period we can prescribe desensitizing toothpaste to the patient, and 1 week after scaling, patient can be completely sensitive free after scaling in case of gums problem. If sensitivity is because of cavity or because of attrited tooth surface, then we have other treatment plan to desensitize the tooth surface. So scaling does not cause any sensitivity of the tooth surface. Sensitivity reduces after scaling in case of gums diseases. The next most common myth we heard about scaling is it is a painful procedure. Generally, scaling is not a painful procedure. It is a painless procedure. Patient might feel discomfort because of the vibration of the scaler. We generally proceed scaling without the administration of anesthesia. In some cases or in some patients it might be painful. In that cases we administer anesthesia and proceed scaling. So I hope you are clear about scaling. See you in the next video with another information. Thank you so much.